Before there were ventilators, we had the iron lung. Before there were blood transfusion machines, blood would be dripping down from your arm to buckets. And before we had anesthesia, we had, well, absolutely nothing. Bite the bullet, maybe. But there were more medical tools from before our time that your snowflake self won't consent to today. I mean, I won't consent to it neither. Bullet extractor. The bullet extractor became widespread around mid-16th century because gunpowder weapons meant battlefield wounds filled with lead. And the surgeons who only knew what they knew needed something to dig the bullets out. Ambroise Paré, the guy who pretty much wrote the manual on battlefield surgery, improved this nightmare tool because back then, medical progress meant making things slightly less excruciating instead of actually bearable. It looked like a long, spiral corkscrew because apparently nothing says cutting-edge medicine like bar tools repurposed for human suffering. The process was exactly what you'd expect. Poke the metal bit deep into the wound, twist it around until it hooked onto the bullet, then yank. Anesthetics weren't a thing, so if you got shot, congratulations. You were getting the DIY surgery experience with nothing but whiskey, screaming, and some guy's knee pressing down on you. If the bullet was lodged too deep or close to something important, like an artery, surgeons would just shrug and leave it there, because if infection didn't get you, lead poisoning might. The mortality rate was ridiculous, not because of the bullet itself, but because of the raw medieval method of getting it out. The 1800s brought forceps that actually worked, and by the 20th century, doctors realized bullets weren't always worth digging for, so X-rays and modern techniques made the bullet extractor obsolete. If someone tried to use it today, they'd probably be arrested for war crimes, and rightfully so. Imagine you go into a hospital for a visit, then the doctor pulls out this thing and told you, "Hey, bite this stick." Yeah, that's a nope. Dental mouth gag. The dental mouth gag was a metal contraption built to force a patient's mouth open during procedures. This is still a medical channel. It's just that these tools are borderline torture methods. It was designed with a screw crank mechanism that, when twisted, locked the patient's jaw in place, sometimes with the bonus feature of cracking a few teeth or popping a jawbone out of place. This thing showed up in the 19th century, around the time when modern anesthesia was beginning to pop out, but not that mainstream yet. It was especially popular in asylum medicine. Of course it was. The doctors in here used it on psychiatric patients under the excuse of feeding them or stopping them from biting. The real horror show started when they used it for tooth extractions, with a dentist cranking the gag open until the mouth was stuck wide enough to work, ignoring whatever damage happened along the way. Many patients left with broken teeth, dislocated jaws, or, if they were lucky, just lifelong trust issues with anyone wearing a white coat. These things came in different styles, like the Burkhardt and Ferguson mouth gags, all with the same core principle of turning mouths into involuntary bear traps. The device started getting phased out when more humane tools and techniques were developed. People don't like their jaws cranked open like nutcrackers. Surprise, surprise. If this thing were still standard today, lawyers would be seeing dollar signs everywhere. Modern dentistry relies on more precise instruments, sedation, and, most importantly, methods that don't require prying someone's mouth open with the same level of finesse as a carjack. Symphysiotomy. Symphysiotomy was a procedure where you used a tool that won't pass safety standards of today. So it was 1597, and a French surgeon with the name Séverin Pinot had a eureka moment. He said to himself in the mirror, "Okay, this is a point in time that a lot of babies get sent to the shadow realm before they get born. What if I just saw the pelvic bone in half to fix this? I like where you're going with this, Séverin. You're a genius." So instead of, coming up with a less barbaric method, doctors grabbed a saw. Yes, an actual saw. Maybe even said,
"I want to play a game."
somewhere between the lines. Then went to town on a conscious, fully awake woman's pelvis to make room for a baby. The mother got little to no anesthesia because pain relief was a luxury back then. Once the bone was split, the mom would barely walk for life. Even then, the baby still wasn't guaranteed to make it. This went on for centuries, but the 20th century doctors, who should have known better, kept the madness alive. Especially in Ireland, where Catholic hospitals didn't like C-sections because they might lead to birth control. Don't ask me what logic was used there. So, instead of giving women safe, sterile C-sections, they opted for a handsaw to the pelvis, which left them crippled, incontinent, and traumatized. It wasn't until the 1980s that Ireland finally phased this out, decades after most of the world. Modern malpractice lawsuits wouldn't even have enough digits to cover the damages if this were to be done today. Now, thanks to actual medical progress, C-sections exist, and nobody has to get DIY carpentry done on their pelvis during childbirth. Ecraseur. The ecraseur was a French creation from the 19th century, and it did exactly what it sounds like. Crushed body parts off, slowly, with no anesthesia. This was back when doctors thought numbing pain was optional and that a good strong grip was all the precision they needed. The device itself was a metal chain loop attached to a screw mechanism, and once the loop was secured around a tumor, polyp, or hemorrhoid, the doctor would crank the handle and tighten the chain until the tissue was strangled and necrotized before finally snapping off. This thing was particularly infamous in gynecological and rectal surgeries, because if you ever wanted to know what it felt like to have flesh crushed off your body while fully awake, 19th century surgery had you covered. The main selling point was that it minimized bleeding by slowly suffocating the tissue. But since germ theory wasn't widely accepted yet during this time, the real risk was what happened afterward: massive infections, sepsis, and, in a lot of cases, death. Some people survived, but calling that survival is a stretch when the alternative was gangrene and a one-way ticket to the afterlife. The ecraseur was largely replaced in the late 19th and early 20th centuries with actual surgical excision, mostly because everyone realized that maybe, just maybe, a slow, excruciating crush and snap method wasn't the gold standard of care. Fleam. This thing was a bloodletting tool that looked like this. It was a hinged, multi-bladed knife designed to slice open veins, because for centuries, people thought draining blood was the answer to everything from fevers to headaches. This wasn't some careful, precise process, as doctors would take the fleam, whack it into a vein, and let the blood pour out, assuming the patient would feel better once they lost enough. If they missed, no problem, the skin's the limit. They'd just keep hacking until something opened up. The whole thing started with ancient Greeks and Romans, who thought balancing the body's four humors was the key to good health. Hippocrates pushed this, and by the Middle Ages, it was medical gospel. Fleams were cheap, easy to carry, and used on humans and animals alike. I mean, you definitely feel a sense of relief if you see your doctor use the knife he used on his horse on you. By the 18th and 19th centuries, barbers got in on the action, using fleams in between shaves. If infection or shock didn't kill the patient, excessive blood loss often did. Once medical science finally realized bleeding someone out doesn't magically cure tuberculosis, sterile needles and controlled phlebotomy took over. Just a little pro tip for you: a butterfly knife is not a fleam even if it slightly looks like it, in a sense. Tonsil punch. The tonsil punch was used for tonsil removal back in the 19th and early 20th centuries. Designed to be quick and efficient, this thing was just a pair of metal pincers with a circular blade at the end, used to clamp down on the tonsils and punch them out in one brutal motion. I mean, of course it goes without saying that the result was severe bleeding, excruciating pain, and the occasional death, which is just great for something that was supposed to help with sore throats. Doctors at the time thought this was a time saver compared to older, slower methods, but in reality, it often left pieces of tonsil tissue behind, leading to infections, excessive bleeding, and, in some cases, people bleeding out. The tonsil punch was commonly used in hospitals and even schools where kids were lined up for mass tonsil removals. This method became a nightmare for both doctors and patients, as post-surgery complications were common, and people sometimes had to undergo a second procedure to remove whatever chunks were left behind. As if it's a shocker that hole-punching human flesh doesn't do the trick. Well, it was a shocker for them. The bleeding was so severe that some patients needed emergency cauterization, or, if things got really bad, a full-on blood transfusion if they make it that far. By the mid-20th century, this method was abandoned in favor of actual surgical tonsillectomies using scalpels and controlled techniques that didn't involve turning a patient's throat into Swiss cheese. Skull compressor. Yep. An iron clamp that doctors in the old days would use for fixing skull fractures. It showed up in the 16th and 17th centuries when surgeons still believed a good bleed-out was a solid treatment plan. The idea was that when someone had a skull fracture, instead of, actually repairing the damage, they'd just crank this thing down and squeeze the bone fragments back into place, assuming the patient didn't die from the pressure alone. The device itself was two iron arms with a screw mechanism in the middle. After it gets clamped down, there was no gentle adjustment happening. Something like this would happen, but of course, to a lesser extent. Still deadly though. The guys pushing this were mostly barber surgeons. They believed the brain could just realign itself once the bones were put back in place, which is exactly the kind of logic that gave us bloodletting as a cure for literally everything. In reality, this thing caused massive brain damage, seizures, and cognitive problems like you were dropped as a child. The pressure could force bone shards deeper into the brain, cause hemorrhaging, or straight up crush the skull further, making sure the only thing getting treated was completely nothing. By the 18th century, as people started realizing that maybe treating the brain like a walnut wasn't the move, the skull compressor started to fall out of favor. By the 19th century, it was fully replaced by early neurosurgical techniques that at least tried to preserve brain function. If this thing had never been scrapped, modern brain surgery would be a joke, and every concussion would have been met with "clamp it till it stops moving." Hooked birthing forceps. Created by the Chamberlain family in the 16th century, these guys hoarded the design like it was the formula for Coca-Cola, passing it down through generations while delivering babies for the rich. These forceps were metal hooks designed to grab onto a baby's skull when labor wasn't going smoothly. If the doctor was skilled, the baby got out with just a few bruises. If the doctor had the hand-eye coordination of an NPC, the baby's skull could get crushed, or worse, the entire extraction could turn into a fatal fetal disaster. These forceps were also used to extract stillborns, meaning doctors sometimes had to break apart the skulls to get them out. Unsurprisingly, mortality rates for both mothers and babies were sky high, but instead of rethinking their entire approach, doctors just kept using them because there was nothing else to use. Eventually, in the 19th and 20th centuries, advancements in medicine and the rise of modern obstetrics made these monstrosities obsolete. The development of safer forceps, better birthing techniques, and the invention of C-sections meant fewer babies had to go through this. Leather straitjackets. Leather straitjackets showed up in the 18th century as a solution for dealing with psychiatric patients. They were mostly made of thick cowhide, tightly wrapped around the torso, with long sleeves that could be crossed over the chest and secured behind the back. The French physician Joseph Guillain, the same guy who thought chaining people to walls was an A+ idea, pushed for their use in asylums. The reasoning? They believed physically restraining patients would stop them from hurting themselves or others. These straitjackets trapped patients in positions that led to muscle atrophy, suffocation, and dehydration. Since you couldn't drink or eat properly while wearing one, unless some nurse spoon-fed you, people ended up severely malnourished or dead. The design also ensured that if someone panicked and struggled, the tight leather made it even harder to breathe. They weren't washed often either, so wearing one for weeks meant living in your own sweat, urine, and other things. Hospitals, prisons, and even ships used them to keep people under control, and by people, they meant anyone society didn't want to deal with. The Victorian era saw them become standard in psychiatric facilities, where doctors made sure that no matter what your illness was, the cure was always leather straps and forced stillness. The horrors of these things finally got enough attention in the 20th century when psychiatric care shifted to medication and therapy, though not before countless patients spent their lives trapped in it. By the mid-1900s, they were phased out in most hospitals, replaced by more humane methods. Tetanus clamp. It was a metal device that was designed to force open the mouths of people suffering from lockjaw, a symptom of tetanus that caused the jaw muscles to seize up so tightly that eating, drinking, or even breathing properly became impossible. 19th century doctors' solution was to jam this cold, unforgiving piece of metal between a person's clenched teeth and crank it open like they were cracking a rusty vault, often shattering teeth and ripping gums in the process. The patient, fully awake and already dealing with a lethal bacterial infection, got the added bonus of oral destruction before either dying from tetanus itself or from the infections. If tetanus didn't kill them, the gangrenous mouth wounds might, since antiseptics weren't used on a broader scale in those days. All of this started because Clostridium tetani, a nasty bacteria commonly found in soil, rust, and animal feces, produced a neurotoxin that attacked the nervous system, causing severe muscle contractions. And since the jaw was one of the strongest muscles in the human body, it went first, locking up so tightly that even swallowing became impossible, meaning dehydration and starvation were imminent unless doctors intervened. While some physicians tried prying the jaw open manually, the failure rate was so high that they opted for the clamp instead. Its use became widespread in the 1800s when tetanus cases were common due to battlefield wounds, unsanitary medical procedures, and the absolute refusal of people to grasp the concept of sterilization. But as vaccines became available in the early 20th century, the tetanus clamp was finally thrown into the bin where it belonged. You don't want to have them used on you then, and you don't want them to be used on you now. Let's be thankful for the advancements medicine has made in our lifetime, and I'll see you whenever.